of how to do it. We started out with a community needs assessment that our local hospital needed to do based on IRS regulations for the not-for-profit hospitals. And when they did it, they decided they wanted to do something even bigger. So our Department of Health and Human Services awarded our hospital with an amazing funding source to be able to improve population health. And our local hospital came to us to subcontract to begin to do that. So what we did was start with our needs assessment, and what you see is a picture of actually a small grouping of, but it was 110 people that day that came together. We listened to what the needs assessment was, and we just had everybody raise a sign if they decided they wanted to flip our community and improve health. And you can see everyone's really excited about doing that. But to the left on this next slide is what our county looks like. We're 740 square miles. And when we started, I don't know if can you see my cursor here? This is all we were, one little clinic of 4,000 square feet right here in the middle of our county. And what we needed to do was to figure out how to do place-based services. And you see we're very far. It takes 43 minutes from this furthest tip to get to where our clinic was here in the middle. So what we did was we looked at, to the right, this scatter map of ER visits from 2012 to 2015, and where you see a lot of heavy dots is where there was the most usage. So what we tried to do was to place an outpost or a satellite in that area, and we just figured out what a 10-mile radius was from that point, hoping that people could, if they had to walk or catch a ride or ride a bicycle, that 10 miles was the magic number to do so. So we put together a lot of churches, and then one high school right up here and a middle school is what we went ahead and did. But to get any further, we had to put together some kind of a model. We are very data-driven, and we tried to look at logically what we needed to do. So we looked at these strategies of the school-based health center, care coordination, which is our church satellite, and how we were going to collect data, and then how we were going to support or be the backbone of this ongoing coalition to improve health. And these intermediate outcomes, or the reasons we were doing that example for the school-based health center, was we strictly, absolutely have this outcome, and that is to decrease unexcused absences. When we looked at it through a systems lens and tried to look at it also through equity, and something that we could sustain, right? We didn't want to go in there and put a nurse practitioner in the school system to take care of all their health. Most people have a provider. We just wanted to decrease an unexcused absence so we could increase graduation rate. That is all we were trying to do. And in our satellites, we want to try to stabilize chronic disease. And those people that we're seeing are the parents and grandparents and guardians of the children that attend those schools. So this is just a quick glance of what our model looked like. In doing so, we were able to set goals and identify a collection of improvement projects. You know, if you don't measure what you're doing, you don't know if you're really achieving it. And just because you achieve the bottom line and check that box doesn't even mean you necessarily are doing it correctly or being able to look at it. So we really look at it through a quality improvement lens. And we did these three things. We wanted to invest in a community of culture of learning. We wanted to use the framework of community of solutions. And we wanted to make darn sure we had voices of lived experience. And we said if we have these three things and we're able to do that, we should be able to measure along the way the process that we're doing things so we can always make sure that we're trying to really achieve exactly what we want. And for example, with our schools, it was to decrease unexcused absences and also to result in a higher graduation rate. And the higher graduation rate was because we learned through being part of Scale Group in the Institute of Healthcare Improvement that the greatest predictor of health is a diploma from high school. So the more children we could graduate from high school, the healthier we're going to be able to have them, and we're going to be able to change the future. And hopefully that where these children lived, where there was 26% uninsured rate, they're able to be able to get jobs and have a better life and a better living. Here is a driver diagram that we put together. So in our coalition, as we're doing, it's twofold, folks. We're providing direct services, the care in our satellites. We're treating folks in our community medical clinic, our original clinic in the city of Camden, and then being that minute clinic in the school, we have all these kinds of drivers and initiatives set up. But leading that coalition, we said, what are we going to do to truly start looking at prevention? So we said 70% of the high schoolers between 14 and 18 were going to be empowered to take charge of their health and co-design solutions by 2020. So the coalition embraced this evidence-based initiative, and we took interns, which is that middle box, Healthy Youth Leadership Development, and we taught them the community of solution skills. And we took the 3 high schools that we have in our community, and we taught those health ambassadors, those one student for each high school, what it would take to transform their community, which is their school. How could they bring about change and well-being through a health club or as being a health ambassador? So we taught them the skills of leading from within, leading together, leading for outcomes, leading for equity and for sustainability. And we paid their internship over last summer, and these students know all about quality improvement lens. They were able to change a system by creating brain breaks in their school, and also they all have a heavy focus on mental health. So that was all looking at having this driver and having them co-design what that is and being a part of what the outcomes and what their process was going to look like. And while we're doing that, just so you know, and I'm not going to go into any greater detail, but we also have this ongoing clinic excellence project because we spread out pretty fast from one clinic to these 6 satellites, 5 of which are churches, and we really wanted to make sure that we were delivering the care everywhere. You know, having a electronic medical record, we had to make sure it worked everywhere, that we had connectivity, that we were able to be documenting the same way. And down in this bottom left corner, you'll see I put some issues that I was going to have to address was retirement of nurse practitioners and how much money I was going to need to sustain that. So just always having this information and these diagrams are real important to share with everyone as you move forward. Also, just to also show you that what I'm saying is true, that this is our PDSA model that we have for the 4 different areas that we're looking at. Each of those little squares, circles, are representing, you know, the plan, do, study, act piece and where we were in it. So establishing and learning an improvement system is really difficult on your own, and it's an absolute learning journey. And as we move forward, we couldn't do it without all of these players you see on this slide. Institute for Healthcare Improvement were really key for us to learn those community of solution skills, being able to have that framework. Being able to look at the Robert Wood Johnson County Healthy Ranking, and our very own South Carolina Department of Health and Human Services, Department of Health and Environmental, all of these individuals and organizations collect data that we can continually look at and assess where we are. We also do our own evaluations and reporting. And when we got this big grant, there was a lot of rigor to collect data and report back what that is. And we became part of the 100 Million Healthier Lives. And so we just learned that it's okay to be innovative and fail forward and things don't happen, but we couldn't do it unless we felt comfortable enough to really understand what those frameworks were. This is an example, again, of when we're working with the community, we are trying to understand the sectors that are involved in the change that we're trying to make, and all the influences that happen, even at the school level and everywhere. Where do you have partnerships? Where can we leverage resources? Who can have some more influences to bring funding or any other kind of information or education to our group? So we did a socio-ecological sorry, that's hard to say, just so we know that was who the players are in our community. And we do like to celebrate and measure. And this is the little road map that we had for our school and where we started and how we were going to be able to look at these priorities for healthy lifestyles for youth and how we started that our first group was a focus group. We actually went to the 3 schools, and we had students from all sectors, whether they were in sports, whether they were in clubs, not in clubs, not just the most popular children. And we actually sat down and did focus groups with them, and all that information was collected. And then we did what we called sense making. We brought people in from the coalition, the adults, and sat down with the youth, and they came up with their own ideas of what all of that information meant. And we came up with our second stop of this evidence-based intervention, and it was all mental health. It was hands down mental health in all 3 schools. And when we brought those high schools together, we did an event when there was about, I'd say, 50 individuals, and 30 of them were from the school. And when they all got together, we have one school district, but it's and about 11,000 children, of which 3,000 are probably high schoolers. And they don't normally see each other, you know, on a day-to-day basis, but when they came together, they found out what was more in common. And they had a lot of bonding and ideas of what they could do to improve the school's overall health. And mental health, I was surprised that it was straight across the board where they felt that they really needed that. So we came up with that evidence-based initiative. They've been very involved with it, with brain breaks. We have mental health counselors now that we were able to bring in every single school. And we just keep tweaking our action plan. And hopefully by 2020, we're going to be able to reach our goal of 70% of the students that are between 14 and 18 that are going to be empowered. This coming April, there's going to be a follow-up, let's say, like meeting or group of each health club within each school to see where they progress. And they measure their outcomes and talk to their sponsored teachers in that school. On this one slide, just showing you how we try to line up all the arrows in the community. So just to focus just on the youth and just keep it in the high school alone was not really going to change the overall well-being of the youth within the community. So our government has Vision Kershaw 2030, and within this document, we do have youth as a target under education and overall well-being of health. This is just an example of how we try to align all our arrows and make sure that we're all on the same page. So when we're transforming the community and trying to look at systems and policy and environment, that we can try to begin to be on the same page. So in summary, for our journey to obtain this community well-being, I think these particular categories are really important. Leadership is key, and a lot of times it's not the people that are elected. These are, informal and formal leaders. And again, I can't honestly stress enough that you have to have the voices of lived experience at the table. It was the voice of a young student who was a sophomore, and that very first slide you saw where everyone's holding the flip sign up, it was her voice that was the loudest, that was saying that the youth needed to be part of well-being, and it was because of that student, that young lady, that advocated for that became our very first, one of the reasons it became our very first evidence-based initiative. And So it's an opportunity. You never know when they're staring you in the face. I didn't know that this clinic was going to become, to be able to subcontract to become an important leader in transforming our community into well-being. So when opportunity knocks, you have to be ready. It's so important to measure things. And again, not just that you accomplished it, but the process along the way. Funding is absolutely key. And to have that shared vision. And you can see in the bottom right-hand corner just the pride on everyone's face when we were able to be recognized as an All-America City. We started with that journey to the left where we all came together after that flip or flop episode, and you see us there ready to go because we all were embracing what our next steps and goals were. And I really want to conclude that, you can look at the glass half full or half empty. What do we need or what do we already have? But you just have to try. You have to fail forward and try again and try again and try again. You just don't know what it will take to be able to change the world or change where you live. So I guess, Rebecca, that concludes my presentation for this portion of the National Civic League for All-America City.
Thank you so much, Susan. I really appreciate your time and presentation. I especially appreciated the messaging about the importance of engaging youth when the program and the project is directly related to their health. I think that's something that seems obvious that a lot of people miss. So thank you for mentioning that. We do have a couple of questions for you in the chat box, but we're going to, again, save those to the end after we hear from Lisa. So keep those questions coming, and we'll make sure they get addressed at the end. And now I'd like to welcome Lisa Campbell, who is the CEO of Create a Change in Las Vegas, Nevada. Lisa?
Hi, Rebecca. Thank you so much. We're super excited to participate today. I just want to thank you for giving us this opportunity, and also want to thank the National Civic League for allowing us to participate in the All-America Cities last year, not too far, almost a year ago. And the city of Las Vegas and all of the members we had such a great time, and it was such an amazing experience, and we really, really appreciate that. We're downloading right now. Okay. Can you see our slides?
Yes, we can.
Okay, perfect. Perfect. Thank you so much. Again, I'm Lisa Campbell, and I am the CEO for Create a Change Now. And a little bit about my history is just recently retired from the city of Las Vegas after 25 years, and my background is in neighborhood revitalization, community organizing, and schools have always been an important part of what I've done within the community. And I also have our program manager, Samantha Slinkard, here with us today. And just, Sam, if you could give a little bit about your background and how it benefits the organization.
Hello, everyone. My name is Samantha, and I'm the program manager. I've been with the organization since May of last year, so I've really been able to see really the great work that this organization does for our community. I'm a current graduate student at the University of Nevada, Las Vegas, studying public health, and I'll be receiving my master's this summer, which is very exciting. But I've done a lot of work in education. My family's been in education here in Las Vegas for a very long time, and I've also done a lot of research on maternal and child health and child nutrition. So this organization was a perfect fit for me.
Great. Thanks, Sam. And today we will touch a little bit about our organization, our history, and our programming, and most importantly, how it ties into the Centers for Disease Control and Prevention's whole school, whole child, whole community model, and why that's important to our organization. As you can see, the organization started, we're in our 10-year anniversary, and we're super excited about that. And this is our wonderful founder, Candace Knobloch, who started the organization in 2009. She has a passion to fight childhood obesity. Currently here in Clark County, We have over 37% of our children are either obese or overweight. So it's critical that we come together as a community and work on solutions to that, and that's what our organization is doing. Candace started at 2 schools and started with the first person to start building quality built concrete beds at our school. So each school gets 4 by 20 beds, and planting and a plethora of different programming that Sam will go into in a little bit. I also want to talk about our board. We have a very diverse board, which is really important to us as a nonprofit organization. We've got members from our corporate and business partners. We have the library district on board, the school district on board, and we also have some healthcare partners. So really helps us as we move forward with our different programming. Over the last few years, Create a Change has gone from creating garden beds to expanding our programming into much more comprehensive and data-driven programming.
Okay, so I just wanted to touch on our Healthy School, Healthy Life programs, which are really the backbone of our organization. So the Edible Desert Gardens, which is what we call our school gardens, they are the hub of all of our programming. So the gardens serve as an outdoor classroom, as a place for the kids to come and hang out with their friends and families. So they're really, we want to make the gardens an important part of the school campus. We also have a garden educator that goes out once a week to not only maintain the garden, but also provide lessons to the children on science, health, and nutrition, and just anything garden related or related to what the kids are learning in the classroom that they can bring outside. So we also encourage the schools to hold farmers markets, which are student-driven. The children do all of the planning, all of the, they help a lot with the harvesting. Grown-ups come and help them with setup, but the students really take ownership of these farmers markets, sell their produce, sell their goods, and it's really a great time. We also offer Move Your Way aligned fitness programs, namely our Create a Change Now Superfood Friends fitness program. And this program is really special because it not only includes physical education, but it also includes nutrition education and plenty of physical activity for the students. This program is implemented within the PE curriculum. We train the PE teacher at the school to deliver the curriculum and to work the kids through the different exercises that come with the program. The program itself is very kid-friendly. We have plenty of pictures, if you are interested, of the different mascots. We have Betty Broccoli and Andy Apple, just all kinds of fun things for the kids to really get engaged and become interested. We mostly work with elementary schools. Well, we exclusively work with elementary schools, so young children. So making things very colorful, vibrant, and exciting for them is important to us. We also provide our chefs. Oh, and the Superfood Friends program was created by Prescott Ellison. He also comes down and helps with the implementation and training of the PE teacher. So we're very thankful for his partnership. We also provide our chefs in schools cooking demonstrations where we bring professional strips from all over Las Vegas. Many of them come from the Las Vegas Strip to come to our schools and give hands-on cooking demonstrations to the kids and their families.
And actually, Candace was actually the first one here in the Las Vegas Valley that started the Chefs in School program with the local chefs, some of them from the strips, as Sam had said. Yes.
So the chefs come in and they provide a cooking demonstration, bring up student volunteers to help them prepare the food. They also provide the students with a nutrition lesson about all the different good stuff that's in the food that they're eating. Most of our recipes, we encourage the chefs to be mindful of allergies, and we also focus mostly on plant-based recipes just to minimize dietary restrictions. But the students really have a great time with it, and they do get to try what they help the chef make. And we also send home recipes in English and Spanish, since our community has a very large demographic, very diverse demographic. So we make sure that everything's accessible to everyone. But the recipes get sent home with the families so that they can recreate the recipes at home. We also provide what we call the Edible Education Nutrition Curriculum, and this curriculum is approved by the Clark County School District for grades K through 5. It was developed thanks to a very generous donation by a registered and licensed dietitian here in town from the University of Nevada, Las Vegas, as well as teachers from the school district. They put together a nutrition curriculum that is not only very comprehensive, but it's also kid-friendly and easy to fit into the school day, because that's one challenge that we've identified is just finding time to teach health education and nutrition curriculum because of the high rigor. But this curriculum does meet CCSD, Clark County School District, core standards for health and nutrition education for elementary students. So it's accepted, it's approved, and the teachers, it's very easy for them to implement it within their classroom. To assist with the implementation, we do offer 2 different kinds of teacher trainings. We have the Edible Education Nutrition Series, which is a 15-hour, 4-credit professional development course that we offer in conjunction with the Clark County School District. Teachers come in and they learn how to master the curriculum. They're able to work directly with the dietitian who created it to learn how to deliver the curriculum. Like I said, they receive professional development education credits for it, so it's good for them as they're hoping to move up. We also provide the Edible Education 101 training, which is an on-site teacher training. We typically offer these during in-house grade level meetings and these meetings are when the teachers from the various grade levels get together to plan their curriculum for the school year or to plan changes in their curriculum based on testing needs. So our dietitian, she goes onto the campus, trains the teachers. It's basically a quick and dirty training similar to the 4-credit PDE training, professional development education training. But it goes through the curriculum. Teachers are able to ask questions and work it into their lesson
And what's
plan.
nice about that is that one is on site.
Yes, so it's very easy for the teachers to get to. We also leverage our very strong community partnerships. We work closely with a group called Trauma Recovery Yoga here in town. They provide their mindful movements program at many of our schools. And this program is a mindfulness and yoga program to help teach the kids self-regulation and coping skills. Because we mostly work in low-income neighborhoods, the students are exposed to a lot of different things that may be causing them stress that takes away from their ability to focus in school. So the Mindful Movements program is very valuable to a lot of our students. And it's also a lot of fun. We have kids as young as 5 years old, little kindergartners, practicing their yoga and their meditation. So it's really providing them with great skills as they get older.
And if you saw them, it's the most adorable thing you've ever seen to see five-year-old kindergartners doing that. And then, Tim, I'm sorry, I don't know if you mentioned this, but we do coordinate with the schools so that every class throughout the school year has the opportunity to participate in the trauma recovery yoga.
And as well as the rest of our programming.
Exactly.
We also leverage off of our partnership with 3 Square Food Bank. We have a very close partnership with this food bank. They are the largest in Southern Nevada, and they provide their pop-up produce program exclusively at our schools. And what that program is it's a free monthly delivery of about 1,500 pounds of produce to each one of our schools. And so we work very closely with 3 Square, work closely with the schools to make sure, that the logistics are right. But every child gets to take home a 3 to 5 pound bag of produce each month to share with their families. And the produce, it all comes donated from different farmers from California, even from Nevada. You wouldn't think that Nevada has a lot of agriculture, but we do have quite a bit. And they bring home potatoes, celery, bell peppers. I've seen pears in the bags. So they really get to try a diverse array of vegetables and fruits. 3 Square Food Bank also provides their Cooking Matters classes at our schools. And the Cooking Matters classes is a national program, but it's health nutrition education for adults. So we offer it to our family members and the adults who are involved in the schools. It also teaches the parents and family members budgeting for healthier eating, so how to spend their money most effectively at the grocery store or the farmer's market. We've found anecdotally that a lot of our parents and family members at our schools don't believe that healthy eating is feasible for them because they are low income. So what this class does is it teaches them that, yes, they can afford to eat healthily, and yes, it's actually cheaper than buying fast food for dinner every night. So it's a very exciting program, and we've had a lot of success with it so far. We also support garden clubs at the schools, and these clubs are essentially planning committees composed of students, parents, and other family members, teachers, the admin, and community members. So it brings everyone together to plan their health and nutrition activities for the school year. And some of our schools, they meet several times a year, which is very exciting.
And I think what's important with the programming piece that we want to touch on is the importance of annual individualized school plans at each school. So we, at the beginning of the school year, we meet with each of our admin teams and we go over what different programming is available to them and what really fits with their school community. And that's really important. And I think the other thing that's really important that you hear Sam talking a lot about is our community partnerships, because we know as an organization we can't provide every service to our schools. So if we can't provide it, we definitely want to reach out to our community partners that are experts in that area and bring them into our annual planning each year.
Okay. So I just wanted to give a quick overview of the framework in which we work. So we have implemented the Centers for Disease Control and Prevention whole school, whole child, whole community model. And this model is very holistic. It's very interdisciplinary. It was actually created by an interdisciplinary team. So they really thought of everything when it comes to school health and how best to engage everyone from the community down to the student in their health. So the WSCC model, it is student-centered, and it does emphasize the role of the community, but it also looks at the connections between health and academic achievement. There's been plenty of research to show that health has a huge impact on a student's ability to not only focus in school, but also perform on those standardized tests that are so important to everyone. So what we want to do as an organization is make it a little bit easier for the students to be healthier so that the schools can start seeing academic results from the kids. The model is also evidence-based, and it incorporates evidence-based school policies and practices. The model is relatively new. It was put out originally in 2016, so it's still being implemented around the country, but in places that have been able to do evaluation, they're seeing a lot of success in improving health and academic achievement in the students, as well as improving family health. And they're seeing a lot of different policies and practices coming down from the school level all the way up to the state or to the district or state level to really bring success and school wellness as a culture change, which is another thing that we want to focus on, is bringing health as a culture change at the school. So Lisa, if you want to talk about the components.
So I'm not going to read all of these. As you can see, these are the 10 components of the WSC model that we've adopted, and the highlighted components are ones that we actually touch on within our organization. So we actually address 8 of the 10 components.
And for health services and employee wellness, we are seeking partners to assist us in delivering this to the schools if the schools don't have that partner already.
And if it's something they want to include in their annual plans that we work on with. This is, again, I'm not going to go over all of this, but just wanted to share with you how the Healthy School, Healthy Life and the WSC model framework come together around our moving forward with our health and wellness from head to toe. And as you can see, we've got the physical education with Superfood Friends and Mindful Movements, and we've just recently added a new partner called Desert Rain, which provides after school with parents, families, and the students. So really focusing on that family engagement also as we move forward, because we know to be successful, it's great if we reach the kids, but we really have to embrace the families also. And health education through our curriculum and our mindful movements around the psychological and social. And we do have other partners on that area also. And then some of the strengths of the model we've listed down below here. And what was important to us is as we move forward to a more comprehensive and data-driven programming, we were researching over the last couple months, Sam, I believe, some best practices for health programming and programming evaluations. And we found the WSC model provides a very solid framework for our schools and for the Create a Change Now programming. And we've also included, for those of you that want to check it out online, the link for the WSC model.
Yeah, so I saw a question, we'll address it later, about equity and WSC implementation. This model is very customizable to individual school needs. So we work very closely with the schools to identify what the school needs, what their community needs, and how we can fulfill those needs. And we also work mainly with at-risk elementary schools to help bring them up to the same level as schools in more affluent areas in academic achievement and health outcomes.
And I think that goes with that annual planning that we were talking about, is making sure that what we're doing fits that community. And another thing that we do for each of our schools is we collect demographic data. So we know what income levels are. We know the ethnicities. We know different things about the culture, so that as we move forward with the planning, we know we have a really good understanding of the community.
So as we were going through the WSC model and talking about it between ourselves and with our schools, we did identify some potential challenges. So this model requires a very coordinated approach. All hands need to be in order for this to work, because it's a community model. So it also takes time to effectively implement, and the evaluations can also take time and be fairly complex depending on the level that we want to evaluate it, the school wants to evaluate it, or even our community partners
our donors, exactly.
So some of the solutions that we came up with, we're going to leverage off of our existing community partnerships. That's one thing that we've always prided ourselves on as an organization, is our strong community partnerships, because as Lisa said, we can't do everything, but we can definitely find people who can and who can do it well. So we are working with local key stakeholders such as higher education institutions, with the local health district, the food bank, and different and other representatives from other sectors throughout the community. We are also working on slow implementation of this model, seeing what works as we go instead of just throwing everything at the school at once. And our selection process for our schools that we work with, I don't want to say that we're picky, but we do look for schools who are ready for that culture change. We work with Title I schools, so schools that are low income, and schools that are 50% free reduced lunch program eligible. So we really look at that. We want to serve the schools and serve the children who need our help and our resources, and our community partners' help and resources the most. We also look for schools that have very engaged administration and teachers, because if, especially in Clark County School District, and I'm sure in other ones, if the principal is the boss of the business, and if they don't want it, then it's not going to happen. So we really work closely with our administration to identify what they would like for their students, what outcomes they would like to see, and we work with them to make sure that those outcomes happen as soon as possible. But this program, this model and our programming is really a long-term plan for the school, so it takes time for us to see many of these outcomes. So we do ongoing evaluation, which brings us to our last point. We do develop individualized plans that include evaluation for the schools. We collect data along the way. We also look at the process, as Susan discussed with her presentation. And we also involve community stakeholders and the schools and the whole school community in that evaluation.
And I think one thing that I do want to mention, too, is that everything that we provide to the schools is free. We seek out the funders, either through grants or through philanthropic partnerships. So everything that we do for the schools is absolutely free and at no cost to them.
Yes. Yes. So those are the challenges and solutions, and we just want to touch quickly on the implications of adoption. So we anticipate with this, with the implementation of this model in our programming, we anticipate improvements in student health outcomes as well as academic achievement for the students. We also anticipate increased family engagement in the schools, in the school community, as well as individual child health and wellness. And by adopting this model and implementing it at our schools, it has really opened the door to us for different funding opportunities, not only for us as an organization, but also for our schools. So this model, because it's evidence-based, it's national best practice, we have plenty of tools and resources available to us through the CDC to do evaluation. Our ability to apply for some very competitive grants and our schools to apply for very competitive grants has increased. So this model is all about sustainability and creating the culture of change within the school. And that's another reason why we chose it for our schools.
And then some of the other is the time and funding requirements for adoption and personnel and partnerships and fundraising, et cetera.
Mm-hmm.
And so that's the conclusion of our presentation. And we just, again, really want to thank the National Civic League and all of you that participated to learn about. And also, Susan, that your great presentation. And we learned a lot. We were taking notes through what you were presenting. So thank you.
Excellent. Thank you, Lisa and Sam, for that presentation. I love that we had two very, similar and related presentations, but both doing important but different work in those schools. And we do have a couple of questions that have come through the chat. The first one is for you, Susan. This is in regards to the health ambassadors and those health clubs that were in the schools. Can you talk a little bit about how active those clubs have been, maybe some of the initiatives that they have that they've undertaken? And there's a specific question about what a brain break is.
Oh, sure. Thank you so much, Rebecca, for the question. So you see, well, you can't see what our driver diagram was, but, what we're trying to do is empower the students to take charge of their health, not go in there and tell them what they need. So we're trying to grow leadership and get them engaged in what it is. So having the health clubs in the 3 different high schools depended upon a leader for that club. So how are we going to choose who was going to be the leader of the club? Instead of it being a popularity contest, which sort of happens in high school, I still think, even though I've been out for a long time, we decided we were going to take it like a job interview. So we went out and we said we were looking for, students with these leadership qualities, and we went through an interview process, and we interviewed students from the 3 high schools, and we had a committee, and we ended up choosing, as we call them, interns. And they were taught, like I said, the community of solution skills, leadership tools to be a leader in their school, and how to go about thinking about change and how to measure it and what was needed. So the health ambassador, the intern became the health ambassador. That was the title we gave them when they went back to their health club, and they were charged, and they're still getting paid for their work that they're doing so many hours a week for that. So it still is important. It just doesn't become a volunteer or another, club on the side, so they still have some commitment to it. And we have a health ambassador coordinator that checks in on them to make sure that they are accomplishing their goals. So one school decided that they wanted more fruit, and eating the fruit in the cafeteria wasn't enough. So there was a grant opportunity with our Blue Cross and Blue Shield Foundation, and those students put together a grant and received $4,000 to be able to develop and put together a fruit cart that they put out right before kids go home for school, because they say they're hungry at the end of the day. A lot of people have a long ride on the bus. These are rural areas that we have in our county, and a lot of kids getting ready, to go play sports. So that was one, which was real exciting, that they got that grant. They were able to go ahead and get the fruit cart. Brain Break is sort of a little bit what Lisa and Samantha were talking about. Is part of mindfulness. They were taught over the summer and interns. They did some yoga, and they went to different gyms and learned about mindfulness. And the Brain Break is saying, gosh, we just learned so much during the day. It's just too much. I can't take it. So there's a thing called, I think it's called Breath of Joy, where they get up and they can energize. There's different ways to do finger tapping and butterfly pats and things like that. So I think they have like a toolbook of 6 different types of brain breaks. Those children or students presented to the principals over the summer and said they wanted to implement this. And I have to say kudos to those principals. They adopted it. They were real excited about it. So now in the school, they take time in the classroom, and it's led by different students, to have these brain breaks so they can go on to the next class. Rebecca, did I answer your questions?
Yes, you hit on all 3 aspects of it. Thank you for the clarification on that. And you actually led me perfectly into the next question, which was about the supervision of these clubs. And you mentioned that there is a representative who checks in with them periodically. So going back to Lisa and Sam, a similar question is, what is your engagement with the schools throughout the year outside of helping them to create the annual plan? Is there some sort of staff or community representative that helps them throughout the year with questions they might have, or sort of tracking their progress?
Yes, absolutely. Samantha, our program manager, has ongoing communication with the schools, and we've also developed a monthly survey that we send out to the schools to make sure that everything is running smoothly. But they definitely have, Sam visits the schools. When we do our chef demonstrations, one of the staff goes out with volunteers, and they participate in that. So we're very much engaged, and I will tell you that most of our schools, we're like part of their school family. We pretty much can just walk in as though we're a teacher or an admin, because we are so highly engaged with them. And we're on speed dial with all the principals and assistant principals, and anytime there's anything that they need, they give us a call.
Excellent. Thank you. And this is a question for both of you. And Lisa, you touched on this a little bit by mentioning that you guys send home recipes that are available in both English and Spanish. But if I can get both programs to elaborate a little bit on the way that you make sure that these programs are inclusive of all students and might go out of your way to engage traditionally marginalized students or children who might not typically participate in something like this.
Sure. I'm going to go ahead and let Samantha, our program manager, talk a little bit about that.
So when we're providing our programming, a lot of our schools, we have a lot of English-speaking only schools, but we also have a program here in Clark County School District called a Zoom school, and those schools are more bilingual. So the teachers are always present at each activity that we do at the school to act as either a translator or a supporter for students who may have language barrier. All of our programming is also accessible to students with disabilities, and our gardens are ADA compliant, so that students of any walk of life or anything, they can take part in all of our programming. In addition, the Cooking Matters program is bilingual. They offer exclusively English or exclusively Spanish lessons, depending on the audience. So we do our best to make it accessible to everyone at our schools. And if we can't do it, then the school certainly helps us with making it more than accessible to their students and to their community.
Excellent. Thank you.
And so the equity lens that we speak about was probably the second tool or core of knowledge that the students learned, which meant that they had to develop whatever they were doing in their health clubs based on need, not just everybody needed the same thing. So that is just something that they took on a whole lot easier than I see a lot of the adults. That was not hard for them to understand. So, for example, I know in the North Central area, which is up in the rural area, when they were just very thoughtful about this fruit cart, and, I'm thinking, well, it'll just be after, in between classes, they were very thoughtful about where it needed to be placed out by the school bus pickup and what time kids came in and what children needed it for what classroom, and just the whole thoughtfulness of it. So, and the brain breaks also included, I think, going into one of the special needs classes and showing them how to do it a little bit differently if they're wheelchair bound. I'm just real proud of them. It seemed like that was not a hard concept for them, but they do everything through an equity lens, and they use that in their language and discussions.
That's great. That's wonderful. Thank you both for explaining how you make these programs inclusive, and it seems like it's starting to become more common for people to just naturally start thinking of those things, which is an awesome progression.
Well, and I should mention also here in Las Vegas, we are I'm going to see if I say this right, minority majority based on our Hispanic population, our demographics here.
Great. So I think that takes care of all of the questions that we had in the chat. I just really want to thank everyone for joining us on today's webinar, and of course a special thank you to and Samantha and Lisa for taking time out of their busy schedules to discuss the great work that is happening in their schools around health. Our next webinar is actually going to be on April 25th, and we're going to be focusing this one on inclusive, healthy housing. So be sure to join us for that. I also want to invite everyone to the 2019 All-America City Awards and Conference. It's going to be June 21st through the 23rd here in Denver. This is the 70th anniversary of the All-America City Awards and the 125th anniversary of the League, so it's going to be a really special year for us. It'll be full of informative workshops, inspiring community presentations as well, always, and some fun anniversary celebrations as well this year. Registration details for the next webinar, as well as the All-America City Awards and Conference, will be sent out in my follow-up email to each of you, and I'll also include a recording of today's webinar so that you guys can reference this or share it with colleagues who weren't able to be on the call with us. But without further ado, I just want to thank you again, and everybody enjoy the rest of your day.
Thank you, Rebecca.
Thank
really
you.
Appreciate it.
Thanks, everyone. Bye-bye.
All right. Bye.